Who shouldn't get the vaccine? Stay tuned and we'll find out. Hey everyone, I'm Ben. I'm a practicing emergency physician in the Midwest United States. Thank you so much for watching The Doctor's Office. In this episode, we're going to be talking about who shouldn't get the COVID-19 vaccine and why that is. Now, to preface this video, I'm talking specifically about the Pfizer and the Moderna vaccine. A lot of this is applying to the AstraZeneca vaccine as well. And as always, this information is the best that I can find at the moment, but things change. This is an ongoing area of investigation. I recommend you do your own research. This is a video summarizing what we know right now. So who should not get the vaccine? And I think it's important to talk about first who should get the vaccine. And the answer is most everyone. Most everyone both can and should get the COVID-19 virus vaccine. It's very important that we build herd immunity because there are people who can't get it, the people I'm about to talk about. And guess what? The way we protect them against the COVID-19 virus is developing something called herd immunity, which means that if enough people cannot get or spread the virus, then the virus eventually will die off in that population group, and it's not something we'll have to worry about. So based on what we know right now, these are the groups of people who should not be getting the COVID-19 virus vaccine. Anyone who has had a serious allergic reaction, meaning an anaphylactic reaction, something where you needed an EpiPen to any of the ingredients or components of the new COVID-19 vaccines. I'll list them briefly on the screen. My next video will be talking more about that. Stay tuned for that video. A lot of it is chemical nonsense. Wouldn't expect you to know by heart what this is. I don't know by heart what all of these are. I have to look them up. But if you're someone who gets anaphylactic or serious allergic reactions to other vaccines, it's something where I recommend you talk to your doctor. They can go over what you have reacted to before, what the ingredients of those vaccines were, and whether or not that portends an allergy to the new vaccines. Number two, people less than 16 years of age. In this age group, we have not adequately studied whether or not that it's safe in younger adults or pediatric patients. I'm not saying that it's unsafe, but it's something that hasn't been studied yet, and there's not recommendations for it, so it's not indicated in these peoples yet. And then finally, people currently experiencing symptoms of COVID-19 should not be getting the COVID-19 vaccine. Once their symptoms have resolved, then they can safely get the COVID-19 vaccine. And then secondly, there's a group of people who can get the COVID-19 vaccine, but it requires a little bit more of a tailored approach. There are people who should get it with caution, in other words, and have a discussion with their doctor prior to getting it. And these are, like I just talked about, people who have a serious allergic reaction to other vaccines. That doesn't mean that you necessarily can't get the COVID-19 virus vaccine, because oftentimes there's different ingredients, as opposed to the group I just mentioned of people who know that they react to those ingredients. This is a group of people who have reacted to other vaccines, but those vaccines have different ingredients. And in this case, we really recommend you talk to your doctor to get a more firm recommendation. The second group of people who should be cautious about getting the COVID-19 vaccine and should talk to their doctors first are people who have immunocompromised states. And what that means is weakened immune systems. The classic person that I think of when it comes to this group are people who have cancer, people who are undergoing chemotherapy, people who have genetic conditions in which their immune system has been weakened, or people who are critically ill with other illnesses. That requires a case-by-case basis. The next group would be people who are on warfarin or Coumadin. These are people who should talk to their doctors first. And then finally, a large group of people that's getting a lot of public attention are women who are breastfeeding, women who are pregnant, or women who are thinking about becoming pregnant. And the reason for this is women who are pregnant and women who are breastfeeding were not included in the initial safety trials for the COVID-19 virus vaccines. But during the studies, there were women who were pregnant and didn't know about it. And because of that, we do have a small amount of data regarding the safety in pregnancy. The good news is, of the women who got the vaccine and didn't know that they were pregnant, there were no adverse events to either the mother or the growing child from the vaccine. And because of that, there's still just not a lot of data regarding the safety profile in pregnant women, women thinking they're going to be pregnant, or breastfeeding women. But there is enough data for both the Center for Disease Control and the American College of Obstetrics and Gynecology have recommended that if you are a woman who's pregnant or thinking about being pregnant and the COVID-19 vaccine is offered to you, that you can get vaccinated, but it's going to be up to you whether or not you want to or not. This is something where there's not judgment on you. It's an individual risk and reward basis. And if there's more discussion that you need to have regarding that, we recommend you talk to your OBGYN regarding it. If you're comfortable with getting vaccinated without having that discussion, then you can go ahead and get the vaccine, no problem. Now, before I discuss my own opinion and my take on this, I want you to know that this is not medical advice. You should not be making your medical decision based on what I'm about to say. It's only my own opinion. And what I'm saying isn't revolutionary. It's that one of the most important things a mother can do during her pregnancy is being healthy herself. Stopping smoking, exercising, taking medications for your conditions, seeing a doctor. And on the contrary, things that affect the mother will affect the child. We know that COVID-19 is a virus that has potentially fatal effects on people. There is always a risk that if you were to contract COVID-19, that you would be one of the people who gets critically ill. So if you can have something that gives you a 95% chance of not getting that critical illness, that to me is something worth thinking about getting. And then lastly, I want to discuss some people who need to take some special precautionary measures and cautions when getting the COVID-19 vaccine. Anyone with a history of allergic reactions to vaccines should be watched for at least 30 minutes after they get vaccinated at the vaccination center for signs for an allergic reaction. Pregnant women who develop fevers after the vaccine should take Tylenol promptly. People who have received antibody therapy or convalescent plasma for COVID-19 infection should wait 90 days before they get the vaccine. People with a known COVID-19 exposure should wait until they are out of quarantine before getting the vaccine. And people who have gotten another vaccine, like something for hepatitis or measles, mumps, rubella, or any number of the other vaccines available, should wait at least 2 weeks before getting the COVID-19 vaccine. And likewise, if you got the COVID-19 vaccine, you should wait 2 weeks before getting another vaccine. So that's my video on what we know so far about who should and who should not get the COVID-19 vaccine. I know I said it a lot in the video, and I hate to sound like a broken record, but if you have other questions, this is something that's complicated. It's your own health. You should take it seriously. So talk with your doctor about your own conditions to discuss whether or not the vaccine is right for you or not. This is generalized information just to try to get you to know what we're talking about and current guidelines as of right now, meaning early January 2021, and may not represent the information at the time that you watch this. I hope you did find it helpful though. If you did, give me a like and a subscribe, hit the bell button below. That helps boost me in YouTube's algorithm and helps this video get out to other people like you. And as always, stay happy, healthy, informed, and empowered.